Enteroviruses are also known to be rare causes of neurologic complications. They can cause meningitis, they can cause inflammation of the brain and the brainstem and the spinal cord. But again, these severe neurologic complications are rare. To date, the Center for Disease Control and Prevention yesterday reported that 45 states have confirmed cases of enterovirus D68. There have been 5 children who've tested positive for enterovirus D68 that have died. The association between that viral infection and that child's death, or those children's deaths, are unknown. An example of that would be someone with a cold who gets in a car accident and dies. It doesn't mean that that death is due to that virus. So we're still waiting more information to find out if that virus was the cause of death in those children. There have been reports, mostly coming out of Denver, but also in other states, of children who are presenting with neurologic complications, muscle weakness, and partial paralysis. Some of these children have also tested positive for enterovirus D68. Additional testing is being done in those children to try to determine the cause of that presentation of that paralysis. At this point, it is unknown if this enterovirus is causing that manifestation or that clinical presentation, but we're still waiting on more information. There are tests available for enteroviruses. Most laboratories can do molecular or RNA-based testing to identify enteroviruses. However, testing for enterovirus D68 requires additional specialized testing that is mostly being done either through state reference laboratories or through the CDC. So there's no real-time rapid test to identify patients with enterovirus D68. The CDC is currently recommending testing for patients with either severe disease requiring intensive care or patients that may have unexplained causes of weakness or paralysis. This time of year, we always want to make sure that people are thinking about how they can protect themselves and keep themselves healthy. Again, aside from enterovirus, we are seeing lots of other respiratory viruses in the community. You can protect yourself by washing your hands, staying home if you're sick, keeping your hands away from your face, covering your mouth if you cough, and if you have a fever, staying at home. It's especially important now to get vaccinated against influenza virus as we are getting ready to enter influenza season.